Modern safety standards weren't born from foresight, but forged in tragedy. This video explores 5 catastrophic moments that forced humanity to confront its vulnerabilities and rewrite the rules of safety. From industrial disasters to transportation failures, each event exposed systemic flaws that demanded immediate action, proving that regulations are often written in blood. On March 25, 1911, 146 garment workers perished in New York's Triangle Shirtwaist factory when fire broke out and locked exit doors trapped them inside. This preventable tragedy exposed the deadly cost of profit over safety, leading to America's first comprehensive workplace safety laws and the creation of the Factory Investigating Commission that transformed industrial regulations nationwide. In the late 1950s, the drug thalidomide prescribed morning sickness caused severe birth defects in approximately 10,000 babies worldwide. The disaster revealed gaping holes in pharmaceutical testing, forcing the FDA to strengthen drug approval processes in 1962. This established rigorous clinical trial protocols and the concept of informed consent that protects patients to this day. When internal memos revealed Ford Motor Company knowingly sold Pintos with defective fuel tanks that could explode in rear-end collisions, calculating that paying victims would be cheaper than recalls, public outrage forced landmark changes. The 1978 investigation led to mandatory crash testing, fuel system safety standards, and corporate accountability laws that prioritized lives over profits. The 1984 Union Carbide pesticide plant leak in Bhopal, India, released deadly methyl isocyanate gas, immediately killing thousands and injuring 500,000. This worst industrial accident in history exposed the lack of transnational safety protocols, leading to the U.S. Emergency Planning and Community Right to Know Act and stricter international hazardous material handling standards. Analyzing these tragedies reveals 3 fatal patterns: prioritizing profits over safety, ignoring warning signs, and lacking oversight. Each disaster occurred after repeated warnings were dismissed, proving that without enforced regulations, history repeats. The common thread: human lives treated as acceptable losses until public outrage forced change. These 5 moments collectively transformed safety governance: OSHA for workplaces, FDA drug trials, NHTSA vehicle standards, and EPA chemical controls. New technologies like crash test dummies and gas detectors emerged from these failures. Most importantly, they established that corporations couldn't self-regulate. Independent oversight and whistleblower protections became essential. Despite progress, new threats emerge where regulations lag: AI systems, climate disasters, and pandemic preparedness. History teaches that safety advances only after catastrophe strikes. The question isn't whether new dangers exist, but whether we'll act proactively or wait for the next preventable tragedy to force change. Behind every regulation are lives lost and survivors who fought for change. The Triangle Fire's worker advocates, Thalidomide parents, Pinto crash victims, and Bhopal protesters turned grief into action. Their legacy proves that while systems fail, persistent public demand for accountability creates lasting change, making citizen vigilance our most crucial safety feature. From 1911's locked factory doors to today's AI ethics debates, safety evolves through painful lessons. These 5 moments teach us that regulations aren't bureaucratic red tape, they're collective wisdom bought with lives. As technology advances, we must remember, true progress isn't just innovation, but ensuring innovation doesn't outpace our humanity. The next chapter in safety history is ours to write.